Good afternoon. It is a great pleasure to introduce Professor Malik Azharuddin sir, an esteemed cardiologist and a distinguished faculty member of Aligarh Muslim University. और ये मैं आपको बता दूं कि शायद जो अलीगढ़ और नॉर्थ इंडिया में जो वन ऑफ द टॉप मोस्ट कार्डियोलॉजिस्ट हैं वो सर उनमें से एक हैं और ये हम लोगों की बहुत खुशकिस्मती है कि अभी इससे पहले हमने हामिद का सुना और अब हमारे साथ जो है नॉर्थ इंडिया के जो टॉप कार्डियोलॉजिस्ट हैं वो हमारे साथ मौजूद है और हम शुक्रगुजार है कि सर ने अपने बहुत बिजी शेड्यूल में से हमको टाइम दिया। तो थैंक यू सर एंड आई एम रिक्वेस्टिंग विद दीज वर्ड टू यू, प्लीज स्टार्ट योर लेक्चर।
Thank you for the kind introduction, and I see some familiar faces in the audience, some seniors, some juniors, and some relatives as well. My wife is in the audience, so I have to be like really careful. So I know that you have heard a lot, and most likely there would be some repetition. जो चीज़ें आपको पहले बता जा चुकी हैं उनको हम हो सकता है दोबारा दोहराएं, बट सम रिपीटिशन इज़ ऑलवेज गुड। ठीक है, सो आई हैव गॉन थ्रू द लिस्ट ऑफ टॉपिक्स, सो आई हैव ट्राइड टू नॉट रिपीट थिंग्स, बट सम रिपीटिशन हैपन्स एनीवेज. So today we'll be in this talk discussing about the role of hypertension in the role of exercise in the management of hypertension. So before getting on to that, let's have a brief overview of circulatory system. So the circulatory system is like plumbing in the house. There are some similarities, of course there are some differences. So like in any circulatory system or any plumbing system, there is a pressure head which drives the motion of the fluid through the circuit. Like in your home there is an overhead tank which has the pressure head which drives the water through the taps and out. Mostly in the plumbing system in the home there is no return circuit. The water comes and goes. It's a one-way street. In your body the blood cannot be lost because it's precious, so we have a means for the blood to come back and get recirculated. So that is why it's a circulatory system. It's not a one-way traffic. The same fluid is getting recycled again and again. So it's more like your water cooler in which there is a tank and there is a pump which recirculates the water. So but the key difference between a water cooler circulation and a human circulation is, in water cooler there is only one circuit. It's a pump, the tank and the grass which needs to be wetted. In human body there are two different circuits running in parallel. So it's like there are two coolers running with a single pump, but the key difference is heart, although is one, it has two different systems, the venous system and the arterial system. So there are two different pumps which are joined together. The RV, the right side which is like blue here, it's the separate pump and it runs independent of the left system somewhat. Okay, so right heart of the body, it pumps and drives the blood to the lungs. So it maintains one circulation and then the other circulation is the left side. But another difference is they are not totally in parallel. They are in series. So the blood comes from all over the body to the right atrium, the right side of the heart. It takes the blood. Atrium is the chamber which is like passive. It just collects blood from all over the body. It stores and it passes on to the next chamber which is the active pump. It has muscle, it contracts and it pushes the blood through the valve which goes to the lung. So the function of valves are to prevent backflow. Okay. Otherwise what will happen is the heart would pump, some blood would go forward, and then if there is no valve it will just fall back into the chamber again. So there would be no effective forward flow. So valves, they keep the blood from coming back, and the muscle, the heart, it drives the pressure and moves the blood forward. So the blood comes on the right heart atrium, goes to the right ventricle, goes to the lung. From the lung it gets oxygenated, then it comes back to the left atrium, not aorta, left atrium, then it goes to the left ventricle. Now the left ventricle is the strongest part of the heart. It has the thickest muscle, so it contracts really vigorously and generates a lot of pressure, which drives the blood to the aorta and through the whole body. So it is the left ventricle that is the main key driving force of the blood. That is the main pressure head. Okay, and then from the body it comes back to the right atrium. But before it comes to the right atrium, it passes through something very intricate. This, what is like shown here, this is the capillary network. So what is capillary network is the conduit vessel, which is the aorta. It is it's most like a fixed pipe. It does not increase or decrease in diameter, although it's not a passive tissue like a pipe. It has a lot of active component, but more or less it does not contract or relax, and it is a passive structure. So it takes the blood from the left part of the heart and it distributes to the individual organs. So it divides into different arteries. The arteries divide into smaller arteries, they divide into further smaller arteries, and by the time it reaches the organ tissues, it is called arteriole. So arteriole is a smaller artery, but it is still muscular and it can contract and relax, and it divides into very thin vascular structure, which is called capillaries. So why do we need capillaries? Is because capillaries are leaky. So all the good stuff in the blood, which is the oxygen, the nutrients, the glucose, it has to come out to the tissues. It can only come out if there are holes and passages in the vessels. Arterioles are not permeable. So all the good stuff that your body needs is trapped in the arteries that cannot reach the tissues unless it passes through capillary network. So capillaries are very important, because if there is no capillary network, all the good stuff in your blood will not reach the individual organs and tissues. So that is the role of capillaries, is to deliver the nutrients and oxygen to the tissues, and after it passes through the capillaries, the oxygen is all used up, and the same blood which was oxygenated before now becomes deoxygenated, and it is collected from the capillaries into small venules, which combine together and forms bigger veins, which combines together to form even bigger veins. The lower part of the body drains into a vein called inferior vena cava, and the upper part of the body superior vena cava, and they both join the right atrium. So that is how the circulation is complete. So like in any, I am sure you have physics background, so in any tube, if some fluid has to pass through, it has to have a pressure head. Okay, while the fluid passes through the tube, the pressure is lost. So that is based on how much pressure is lost, is based on how much resistance the tube offers. The amount of resistance is proportional to the diameter of the tube. In the body, the combined diameter of all the arterioles, so individual arteriole is very small, it's micrometer in size, but if you join the cross sectional area of all the arterioles, it is an immense area. So aorta would be like maximum to maximum 10 centimeter in a very diseased individual. Average it would be like 3.5 to 4 centimeter. So 4 centimeter cross sectional area is not a large area, but it's not a very small area. But if you compare this area to the area of all the arterioles together, so it's a very vast area. So effectively the pressure falls to 4 to 3 mm of mercury at the level of the arterioles and capillaries. So all of the pressure that the aorta started with, it's lost, because it's exposed to such a wide area, and practically capillaries, they don't offer any resistance because the area is so wide. Although जो diameter है capillaries का वो बहुत, it's very small, but the area is so wide that it offers practically very little resistance. So where the most resistance comes from, it is from arterioles, the small muscular arteries. And unlike your tubing in your home, which is fixed. Arterioles are very dynamic. Dynamic meaning depending on your need and capacity, their diameter can decrease or increase. That is the way of body to control your blood pressure. Sometimes you need your blood pressure to be high when especially you are exercising, or in certain situation like when you are lying down and when you are standing up. A big difference is gravity. So sometimes we fail to recognize, but it is very important. A person who is 5 feet tall, the forces of gravity between his foot and brain are immense. If there was no regulatory mechanism, but as soon as the person stands, his blood would all pool in the lower limbs and he would get no blood supply in the brain. Or if his blood pressure is constantly very high, to compensate for that, when he is lying down, his brain would be exposed to unacceptably high blood pressures. So there are mechanisms in body in which sometimes you need to increase your blood pressure and sometimes you need to decrease the blood pressure. So major mechanism is to contract or relax your arterioles. So your body modulates the resistance of the blood pressure, blood vessels, to increase or decrease your blood pressure. Is it too much? Any questions? So why am I spending some time in explaining resistance? Is because exercise, it changes the resistance of your arterioles. Okay. So where is the bulk of all these arterioles located? No. Heart is the chamber which drives the blood. It is not the target organ. So no. Lungs is different. Lungs has a function that it adds oxygen to your blood. That is the that is the main function. The end organ, the target is brain, your muscles, your kidney, your intestines. Okay. So these are the end organs that need the blood. Lung can survive even without the oxygen from the blood, because lung is directly exposed to the oxygen of the air. So lung doesn't need the blood to survive, because lung can get the oxygen from air. Of course, lung needs the nutrients part of the blood, but it is your organs which do not have oxygen unless they are exposed to blood. Okay. So your organs, internal organs as well as skeletal system. So two major areas where there is a lot of blood vessels and lot of capillary network is your intestines. There are meters and meters of intestine packed up in your body. So intestine and this splanchnic system is one organ where there are a lot of blood vessels and it can regulate its resistance. But the resistance or the diameters of the intestinal organs doesn't change much with exercise. It's almost the same. Your muscles is the organ which gets trained and adapted, and when you exercise, its blood vessel dilate, they increase in diameter or decrease in diameter depending on your level of training. So it is the muscles which are very important. Not muscles, people think that muscles are important because they look nice and you get a body out of it, or they help you move around. People think muscles as a passive organ. Even doctors think that muscles are they are just means to an end to transport yourself. That is not true. Muscles are an active organ that help in maintaining the metabolism of the body. What is metabolism? The ability to use glucose and convert it into useful activity and a lot of other things. So muscles not a passive organ. Muscles not only an end organ which use glucose and which help you go from one place to other place. In fact, loss of muscle mass is an important part of aging related health issues. Anyways, let's come on to the issue at hand. Is what is hypertension? So the definition of hypertension has evolved and has been changing over time. So why now, what is the current accepted definition of hypertension is a systolic blood pressure of more than or equal to 130 millimeter of mercury and a diastolic blood pressure more than or equal to 80 millimeter of mercury. What is millimeter of mercury? It is a way to assess the pressure. It means 1 millimeter of standing height of mercury, the amount of pressure it will subtend is equal to 1 millimeter of mercury. What is systolic SBP? Systolic BP, meaning the highest your blood pressure would be at any time, and diastolic blood pressure is the lowest. So there are second to second variation in your blood pressures. Blood pressure is not fixed, unlike your home system in which the pressure from the tank would be the same in the tubes throughout. It doesn't happen like that. Once your heart contracts, it pumps the blood, pressure reaches very high, and then it falls slowly, and with everything that you do, your blood pressure changes. You are taking a deep breath, your blood pressure falls because your lung expand, the thoracic pressure falls. So with breathing, with moving, with getting up, with walking around, with even thinking, if you are too much stressed, too much strained, blood pressure varies. So when blood pressure varies so much with every little thing you do, how can you be sure what your blood pressure is? What is your true blood pressure? So instantaneous blood pressure is not important. You do not make a diagnosis of hypertension based on instantaneous blood pressure, meaning blood pressure of that moment. It is a very important thing to understand, and it is a very important cause of confusion. A lot of patients, they come and they say, Doctor Sahab, हमारा blood pressure बहुत fluctuate करता है. I tell them that is good. If your blood pressure fluctuates with your activity, that is a sign of healthy heart. Healthy people, when they exercise, their blood pressure should increase. If their blood pressure does not increase with exercise, then it is a sign of disease. So then again comes the question, how do we diagnose hypertension when blood pressure varies so much with every little thing that you do? So there are very stringent conditions in which you assess for hypertension. What is that? You should be resting and relaxed, preferably at home for at least 30 minutes. So if you have come from some outside work or something, you cannot measure your blood pressure, and it would not be reliable measure of hypertension. Okay. Rested and relaxed for at least 30 minutes, sitting comfortably, feet on the ground, feet hanging in the air नहीं होना चाहिए, back well rested होना चाहिए. So that is a posture in which blood pressure should be measured. The most convenient times are when you get up in the morning, you are totally awake. Immediately after rising from the sleep, blood pressure spikes up. So you wake up and immediately measure your blood pressure. That is not good. You should be fully awake and oriented. Of course, if you are drowsy, you are still sleepy, lightheaded, then your blood pressure would not be accurate. It would be either high or sometimes maybe even lower side. No tea or coffee. No smoking. If you have smoked a cigarette, then your blood pressure would spike. If you had a cup of tea or strong cup of coffee, basically caffeine. Caffeine raises your blood pressure. So okay, no tea, no coffee, no immediate exercise, no smoke. You should not smoke at all, but at least don't smoke and take your blood pressure. Okay, and then you take it another time and do this like 4 to 6 times. Okay. Now in every particular instance, ideally you should measure blood pressure thrice or 4 times and take the median value, not the average. Don't take the highest or the lowest. So like if one time it is 160, one time it is 130, one time it is 110, one time it is 105. So you take the middle value, not the average. Average is not shown to be best. Okay. So the higher reading, if it is more than 130, taken like this, and the lower reading, if it is more than 80, then we call it hypertension. And this is home BP, not clinic BPs. Usually when a person goes to see a doctor or in a clinic, usually the blood pressures are higher. And unfortunately in India, the things that I have described, how to take blood pressure, we don't have that. We don't have a quiet room in our OPD. Our patients are not rested for 30 minutes. So unfortunately, the blood pressure which is checked at the doctor's clinic India-wide not the most accurate, है ना. Unfortunately, it's not that predictable that you go and get your blood pressure checked in the clinic and you subtract 10 and then you will get your true blood pressure, because for some people they may have 15 millimeter high raise, some people may have only 5 millimeter raise. So the best thing is a home blood pressure, but again you have to understand the caveats that it may increase or decrease. So single blood pressure value can never make the diagnosis of hypertension. You have to have persistent demonstration of higher blood pressure, okay. And it affects millions and millions of people worldwide, and hypertension increases the risk of stroke, cardiovascular disease, peripheral artery disease. The list is very long and I am not going to go into that. Apart from that, hypertension can also be categorized as essential or secondary. Essential meaning that we don't have a definite cause for it. So like there are a lot of diseases in which we have a cause. We know malaria is caused by a pathogen, and there are a lot of bacterial infections which cause particular diseases. So like other diseases which have a definite cause, we don't know why hypertension happens in most people. There are a lot of multiple small causes which contribute to causation of hypertension, but हमें ये नहीं पता है कि exactly blood pressure होता क्यों है, which is another common question. People ask me, Doctor साहब हमें क्यों हो गया hypertension? I tell them I don't know, nobody knows. So it is what we call in scientific terms idiopathic. So most 80% of hypertension, they are essential hypertension. We don't know the exact cause. There are multiple mechanisms which play a role, but we don't know the exact cause. But there are certain causes of hypertension in which we have a certain cause. So like kidney disease, somebody had stones in kidney and their kidney got damaged, they can have high blood pressure because of kidney disease. Because of metabolic disorder, like Dr. Hamid might have told you in the morning, almost all endocrine disorder can lead to hypertension. Cushing syndrome hota hai, hyperthyroidism, hypothyroidism. So if we have a disease, separate disease which is causing hypertension, it is called secondary hypertension. But most of the individuals, they have what is called essential hypertension, in which there is no cause. So in hypertension, exercise is actually the first line of treatment. The first line of treatment is not drugs, it is diet control and exercise, especially in mild hypertension. So like initially there were classifications which were followed very diligently. More than 140/90 was called hypertension, then there was stage 1 hypertension, there was stage 2 hypertension. Now those staging is less followed because there is no evidence that stage 1 hypertension doesn't need treatment, stage 2 needs treatment, like that. So if there is hypertension, you need treatment. But there is still a gray zone. What is the gray zone? 130 to 140. So if your blood pressure at home is more than 130 but is less than 140, so there is data, there is evidence that if we give you blood pressure medication, you will benefit, but there is also chance that your blood pressure might get too low. So in early hypertension, treatment with medication also has certain disadvantages, that you may have what is called hypotension. Hypotension meaning your blood pressure fell too low, and when you are getting up, you are getting dizzy and all that. So in early mild hypertension, sometimes medication may not be the best strategy, but in all forms of hypertension, exercise and diet control is important. The benefit which exercise can give, medication cannot give. And the other thing is also true, like the benefit which medication can give, if it is needed, the exercise cannot give. There are a lot of people who very proudly say, Doctor साहब हम तो मेंटेन करके रखा हुआ है, हमें तो दवा की ज़रूरत ही नहीं पड़ रही है. And when asked कितना रहता है, कुछ नहीं, बस कोई 160 रहता है, बढ़िया है, I am fine. Unfortunately in hypertension, symptoms come too late. Symptom meaning तकलीफ, symptoms come too late. By the time आपको फालिज होगा, हार्ट अटैक होगा, it's already too late. So hypertension can only be diagnosed by measuring. That is the role of routine health checkup. So a lot of people are very fond of getting their investigations done, like हमने अपना complete body checkup करा लिया है. That is much less useful, getting your blood test done, than a simple measurement of blood pressure. blood pressure should be checked for every living human being, because blood pressure can only be diagnosed by measuring. Symptoms से नहीं पता चलता है. Sometimes you may get symptoms, sometimes you may have headache, but mostly hypertension is silent. That is why it is called a silent killer, because by the time symptoms happen, it is already too late. Okay. In some patient, simple exercise may be enough and their blood pressure may get controlled. But it may not always be the case. It does not matter how your blood pressure is controlled. If it's with exercise alone, it is good. But if it is not with exercise alone, then there should be no hesitancy in taking medication. Okay. Even if you are needed, that medications are needed, even then exercise should not be abandoned, because it can still provide you with lot of other benefits. At the very least, it will reduce the need for number of drugs. If your blood pressure is controlled on 3 drugs, it may be controlled on 2 drugs. And even if it does not reduce the need of medication, there are multiple other benefits that we will soon see. Okay. So now, how does exercise lower your blood pressure? So as I said, that the arterioles, they are important. It relaxes your blood pressure, blood vessels. So the arterioles, they relax, and the resistance, it falls, so blood pressure falls. How does it relax the arteriole? By a lot of mechanisms, but primarily it causes the endothelium. So what is endothelium? Endothelium is the lining of cells inside your blood vessels. So as I said, they are not like passive tubes. They are tubes, but they have a lot of active substances going on, active things going on. So the innermost lining, it's like a paint job inside the bow, but instead of a simple layer of paint, it is cells which are joined together to form a tube. So that cell ka tube, it is called endothelium. So at different places it has different function. As I said, in the smallest vessels, which are capillaries, it has holes, it is leaky to allow the passage of the nutrients and the oxygen into the tissue. At other places, it is not leaky, it is tight, but it can release substances which help the muscle to relax. So one of those substances is nitric oxide. There are a lot of other substances. So that is one way it lowers the resistance at the tissue level. Then exercise also reduces the sympathetic nervous system activity. So what is sympathetic nervous system? It is a mechanism which triggers fight or flight response. Like if you are in a danger, your body instinctively runs away from it. So that is not based on your decision making thinking, that will take too long. And if you touch something hot, your hand immediately withdraws. That is, you don't think, oh, it is hot, I felt hot, you withdraw your hand. So these are reflex actions. So sympathetic nervous system is your body's mechanism to fight danger. It raises your blood pressure, it raises your heart rate, it improves blood supply to the muscles, and it helps you run. But sustained level of sympathetic nervous system activity would be bad, because it would raise your blood pressure unnecessarily. So stress, it raises your sympathetic activity, it releases adrenaline and causes your heart rate, blood pressure to rise. So regular exercise, it helps control sympathetic nervous system activity by raising vagal tone. Vagal tone is parasympathetic nervous system. That is the sort of opposite nervous system which helps control the adrenergic response, and it helps keep in check. I think I am getting too boring. Okay. I am mixing some words, scientific words, because they are very common. Sympathetic nervous system is a common word, and you might have come across it a lot. Okay. So it helps at the tissue organ level, it helps at the brain level, and it helps at the tissue level in another way, indirectly. One is it directly relaxes the blood pressure. The other thing is it enhances this thing. Okay. So insulin is a very important hormone, and it has its hand in everything. Okay, so it affects and modulates so many things that one little thing that goes wrong with insulin action is the root of majority of the problem, that is insulin resistance. So all of you must have had one relative, I am sure, or a friend in India who has diabetes, because it's such a common disease. And the adult onset diabetes, which is the typical diabetes, which is called type 2 diabetes. Everybody knows that in lack of insulin is the problem, but type 2 diabetes mein lack of insulin is not the problem. It is the insulin resistance. It is the inability of insulin to act on tissues. That is the problem. So if you measure the insulin level of a typical type 2 diabetes person, it would be high actually, not low. Low insulin happens in type 1 diabetes, which is usually in kids and young individuals. So what is the basic problem with insulin resistance is the end organ largely muscle. Majority of glucose is utilized in your body in muscles. In brain also, per gram of tissue if you see, then brain also uses a lot of glucose, but brain is small, it's like 1% of your body weight. Majority of your body weight which uses glucose is muscle. So it is the muscle training, muscle enhancement which will help in insulin resistance. Okay, so exercise reduces insulin resistance. So exercise helps insulin act in a better way. So it not only helps with hypertension, it helps with reducing your overall body weight, reducing the chances that you have diabetes and all the other components of metabolic syndrome. I'll get on to it. So what are the type of exercise? I am sure this must be taught to you in more detail because there are other talks scheduled. So I will not go into much detail, but brief things. So aerobic exercises, muscle strengthening exercises, then there are bone strengthening activity, which is also isometric activities. Then there are activities which help you improve your balance, and then there are activities which improve the flexibility of your joints and muscles. And this is not a like some holy grail classification. It's not mutually exclusive. Some exercises may fall in more than one categories, but largely the first two are more well known and emphasized. Aerobic exercises also called as endurance training. So aerobic exercises are exercises which move large muscles of the arms and legs. So any exercise which elevates your heart rate and elevates your rate of breathing and causes you to work your muscles is aerobic exercise. Usually walking, jogging, running, swimming, in which you are not required to strain a lot, lift weight. Okay, so those are aerobic exercises. They are the what are traditionally called as cardio workouts. Okay, but that's sort of a misnomer, because all sorts of exercises, they help you improve your cardiovascular health. It's not just the aerobic exercises. Okay, then there are muscle strengthening exercises which improve your muscle strength, your power, also endurance. They are also called as resistance training, in which you make an effort against a physical workload, like you are lifting weights, you are doing push-ups, you are climbing stairs, or doing other manual work like digging in garden, etc., etc. So these help you increase the number of muscle cells and the thickness of the muscle fibers and improve your physical strength. So the typical bodybuilding exercises. Okay, then there is a group of exercise which is called isometric exercise. It is more important for us medically speaking. There are a lot of things in which we prescribe isometric exercises. Is that lower wall too low? Okay, so these are the exercises which have static component, meaning that you don't actually move your end organs. So like a tight fist grip, you are not moving anything. It may seem like you are not doing anything, but your muscles are constantly working against a fixed workload. So it temporarily elevates the resistance in the muscles. Doing so repeatedly helps ultimately lower the resistance in the muscles. Okay, so like planks, if you hold you squat, you do any position, contract the muscles and stay that way. That is isometric exercise. A lot of ways you can do it. You can do squats, you can do wall sits like against the wall. Push up, but you push and don't move. You hold your position. You hold from a bar and then you hold your position. So these are isometric exercises. They also help a lot. Then there are exercises which are directed against improving your balance, like walking backwards, standing on one leg, walking from on heel to toe, okay, repeatedly sitting down and standing up. So it strengthens the axial muscles. And why people fall is because they do not have the strength in axial muscles that much. Anybody and everybody trips in their life once or a while, that you fall, but you quickly regain your balance if there is more strength in your axial muscles. What are those? Like calf muscles, the gluteus muscles, your back muscles, so your core body muscles. Okay, so if you strengthen them, your balance would improve. Also, balance happens from an organ called cerebellum. If you repeatedly put your body in a position where it is likely to fall, like standing on one leg, then your cerebellum would be more trained. So part of balance activities not only just trains the muscle, it also trains your body to react in a faster way. Why balance activities are important? They are especially important for elderly people who have more fall issues. If you are only working on improving your muscle strength but not improving your balance, you may actually have more injuries while working out. So it is important for you to be also focused on improving your balance. And then flexibility activities, it involves passive stretching and contraction and relaxation of all the joints of your body. Stretches are very important because unfortunately if you are only working out a lot of bodybuilding and you have your muscles which are looking very good, your muscles will become very stiff, and lot of actually bodybuilders, they have very stiff body and they are only focused on building the muscle bulk. Passive stretches are very important because ultimately your joint need to relax and contract fully. Otherwise, one group of muscle will not act very well if the other group of muscle is very stiff. Okay, so passive stretching exercises, yoga, side stretches, you're touching your toes, anything that makes you completely straighten out your joint, that is very helpful. Then this is not a type of exercise, but what is now being shown, although all exercises are good, certain exercises are better than others. So instead of you walking slowly for 2 hours, in this fast paced world, we are all short on time. So we need to make the most of our time. So if you have only 15 minutes to exercise, it is not very time effective for you to be just walking. Okay, because that will not give you the most benefit for the amount of time spent. On the other hand, if you decide to sprint for 15 minutes at a stretch, you cannot sustain it. You cannot run very fast for 15 minutes unless you are a marathon runner, not marathon runner, but a sprint runner. Okay, so especially to initially start with, short burst of intense activity followed by comparative rest. It is called high intensity interval training, that you run and then you rest, then you run and you rest. Not just run, the activity can be anything. Okay, it has to be intense. So how do you monitor and measure intense? By measuring your heart rate, or if you can't measure your heart rate, just your breathing rate. So if you are doing an exercise, two buddies together, and you are able to talk a lot, पूरी माहौल बन गया और खूब गप्पे लग रही हैं, then your exercise intensity is too little. Intense exercise will make you so breathless that you will be able to say few words, but lengthy conversations if you are able to do, then your exercise intensity is too little. And if you are able to measure your heart rate with some watch, which is very helpful and it is very commonly available, so at least 60 to 70% of maximal possibly achievable heart rate. So what is maximal heart rate? 180 220 minus age. For most people it is 160 to 180, but you can calculate 220 minus your age. So for most people who are 40 years, almost all of us, plus minus a few years, so 180 would be, so 60 to 70% of that would be an intense workout. 40 to 50% would be like moderate intensity, 40 to 50 would be low intensity, 50 to 60 would be moderate intensity. So you can measure your peak heart rate and decide the intensity. However, before high intensity training, you should be somewhat physically active and fit. If you are not and you start sprinting and then you may collapse. So exercise starting should be in moderation based on your physical activity. Heart rate is very, very useful in that. For people who are physically inactive, if you walk for 15 minutes, your heart rate may shoot to 160. For a person who is well trained, even if he runs for 15 minutes, his heart rate would not increase. So heart rate is an important marker to assess your physical activity also. Marathon runners, they have a heart rate of say 50, resting heart rate. Okay, so your heart rate is a very important marker. How much you should exercise? As much as possible, provided you take care of safety and you start graded, but at least 150 to 300 minutes per week is recommended. The amount, the type, that varies. What is the approximate benefit that you hope to achieve? An average of 4 to 9 millimeter of Hg fall in blood pressure. So from the looks, it may not seem a lot. Like on an average 5 mm Hg, it's like nothing. मेरा तो 160 रह रहा है, 5 मिलीमीटर घटा करके हम क्या कर लेंगे? But sustained over time, that is immense benefit. Some drugs, some antihypertensive drugs have only this much benefit on an average 5 millimeter fall in blood pressure. So it is like you are taking one tablet on say like 5 milligram of amlodipine, which is the common blood pressure medication. So if you regularly exercise, you can hope to reduce one blood pressure medication. Okay, you cannot hope to have magic that my blood pressure is controlled on 4 medication, now I am exercising and I will. Some people who have multiple issues, they also have metabolic syndrome, obesity. So blood pressure may be able to bring down, exercise may be able to bring down their blood pressure more by other means, that they lost weight also, they were initially mildly diabetic, now diabetes is also gone, insulin resistance improved. So over 1 year, it may be more than that in some individuals. So the response to exercise also varies. How to go about it? How to actually exercise? A lot of people, they decide, okay, I will exercise, and I have also bought a treadmill, and it is very useful, very helpful. It has a lot of nooks and crannies in which you can hang your clothes. So unfortunately, deciding to exercise is not just it. You have to take a step, and a simple breaking your sedentary habits, sitting in a chair all day long, just take an excuse to walk. Not be sitting in a chair. Unfortunately, most of us are office worker, and unfortunately most of our work involves sitting in a chair, myself included. But thankfully I have to stand also a lot of time in cath lab, so that gives me workout exercises. I take an excuse to run around. I go to my colleagues, have a cup of tea, and although the cup of tea is not that good because it has a lot of sugar, my exercise is wasted because, so, but you get the point. Instead of sitting, you break your sedentary habits, walk the stairs instead of taking lift. If you have to buy some grocery, don't take the scooter, walk. In the neighborhood shop, it would not, the time difference would not matter. By the time you actually start your scooter, sit on it, start your bike, or you walk, hardly a few minutes here and there would be there. Okay? So it is mainly habit. कहीं भी जाना है तो bike start करनी है. So break those sedentary habits. Okay? If you have some device which can count your steps, very good. At least 10,000 steps per day has been shown to have benefits. Even if it is 2,000 steps per day, it is a good thing. Better than zero. So there is no level of exercise which has no benefit. Okay? Because of the risk, at least this much you should do, 10,000 steps per day. But if you cannot do that, at least do something and then gradually build it up. So there comes the role of monitoring devices. Now almost everybody has a smartphone. If you don't have a watch, every smartphone can detect your physical activity and count steps for you. So in today's era, no one can make an excuse that I can't know my steps. Steps is not the end. Steps is not the final target. It's just a means to get you started and to monitor your activity. Okay. Then in the workplace, unfortunately, we don't have workplace congenial to this. We could have standing desks where we come, we do work and then we go. There is no need for us to actually sit in the office. So if we can transform our office spaces, instead of a sitting desk, have a walking standing desk. I am not asking you all to stand up though. So exercise starting is important. Exercise may have some interaction with your pre-existing medications. So one of the class of drugs which is no longer the first line agent, which is called beta blockers. Initially it used to be the first line agent. For now there is evidence that says that beta blocker are not the best antihypertensives. So they have other interactions also. They stop your heart rate from going too high non-physiologically, and they may cause some fatigue issues initially and some poor tolerance. Apart from that, there is not much interaction between your medications and your ability to exercise. But before starting a new exercise regimen, it would be very useful to consult with your doctor, because especially in the middle ages, if you are starting exercise for the first time when you are in your 30s or 40s, it may have some adverse consequences. So while you are doing exercises, what should you check or monitor? It would be useful to check your blood pressure, especially if you are a prior hypertensive. If your blood pressure right now is 180s, 200, that may not be the perfect moment for you to start your exercise. Although in the long term, regular exercise lowers the blood pressure, exercise immediately increases your blood pressure. So before starting your exercise, if your blood pressure is too high, maybe you should rest and relax and exercise at a later time when your blood pressure is more controlled with medication. Apart from that, 140, 150, 160, mild hypertension is not a problem. You can safely exercise. Okay. If your blood pressure is on the higher side, immediately start slow. Don't jump in with intense activity workout. Give your body to adapt to exercise for few months, 6 months, 8 months. Okay. If you are exercising and you are feeling dizzy, stop immediately, especially if you are exercising on a treadmill or some sort of thing. Because if you felt dizzy, you are too short of breath, you may lose your balance and fall and hurt yourself. It is very important for us to not hurt ourselves during exercises, because then your whole goal is to improve your health, and if you broke your leg while exercising, that kind of defeats the purpose. Another important thing is stress management, because we know that day-to-day life stress, it is an important risk factors for cardiovascular disease. So what are the other risk factors? Just to name: diabetes, raised cholesterol, blood pressure, stress levels, lack of fresh fruits, vegetables in your diet. That is also a risk factor. Okay, smoking, physical inactivity. So physical inactivity is a risk factor. If we grade them all in the severity of risk, the highest is smoking. Smoking is the highest. Rest all, diabetes, lack of physical activity, they are all almost the same, some here and there. Stress level is the lowest. Okay, but even 1.5 times increase in risk is a lot if you consider your lifetime. So stress mitigation is important. Stress temporarily raises your blood pressure, and exercise reduces not only your blood pressure but your overall level of stress. It controls your stress induced hormones like cortisol. It helps your heart rate variability, and there are tools and techniques which can directly reduce your stress like meditation, yoga and breathing exercises. So some part of your exercise regimen should also include these meditation type of exercises, breathing exercises, to help regulate your stress levels. Okay, as I already explained, exercise induced improves endothelial function and improves sympathetic nervous system. It also improves arterial stiffness. We discussed insulin resistance, and there is a direct role between insulin resistance and hypertension. So exercise helps by reducing insulin resistance, and it is a key component in metabolic syndrome. So how does exercise improves insulin sensitivity? Improves the insulin receptor function. It makes your muscle take glucose more effectively, and it makes more muscle. So the amount of muscle fiber increases. So now you have more muscle mass, and individual muscle fiber, individual insulin receptors also acts more efficiently. Okay, so more receptors are there and individual receptors are also working more efficiently. That is one way. Other way is it reduces the inflammation. So what is inflammation? If there is any damage in your body, your blood cells, they act and they come, they release some mediators to recruit other cells to repair that damaged tissue. But sometimes even in absence of an external damage, your body inappropriately reacts and releases those substances which thinks that your body has damage. So that is inflammation. And what is oxidative stress? When those cells, they come to repair the damage, they release a lot of substances which can oxidize and damage your tissue. So by regularly exercising, your tissue level inflammatory markers are reduced. So some of you must have heard marker, and a lot of patients, they now come with a CRP report. So CRP is a C-reactive protein. It is an inflammatory marker. It assesses your level of inflammation in your body, and it is an important overall cardiac risk marker, but unfortunately it can get affected with so many things. If you have a cold, your CRP level would remain elevated for like 15 days. So an elevated CRP is less helpful, especially because नॉर्मल कफ एंड कोल्ड, इवन एन अनरिकॉग्नाइज्ड इंजरी, कहीं आपको ठोकर लग गई थी, वहाँ चोट लग गई थी, उसकी वजह से भी सीआरपी बढ़ सकता है. एंड नेगेटिव सीआरपी हैज़ मोर वैल्यू, दैट इफ योर सीआरपी इज नॉर्मल then you don't have inflammation. A raised CRP has less value. So what is metabolic syndrome? The cluster of these things which happen because of insulin resistance, the obesity, high blood pressure, high cholesterol. Many times they go together, and the root cause of all of this is insulin resistance. One thing leads to other. Like people who do not have hypertension, they gained some weight, they became obese, their insulin function worsened, they now have insulin resistance, now they have high systemic vascular resistance, they develop blood pressure. People who have high cholesterol, they get cholesterol deposition in their blood vessels start working not so well, endothelial function declines, and that raises systemic vascular resistance and causes blood pressure. Blood pressure, on the other hand, can affect your endothelial function, damage your tissues, cause insulin resistance, and can cause metabolic syndrome. So these things, one thing can worsen other. So like, what came first, chicken or the egg? It's like that. What came first, metabolic syndrome or insulin resistance? Okay, so metabolic syndrome can cause insulin resistance can cause metabolic syndrome, and they all can cause each other. So we are still in the process of dissecting it out. We don't really know what exactly causes metabolic syndrome or what exactly causes insulin resistance, but we do know for a fact that exercise helps with everything. Improving diet helps with everything. Okay. So as I said, exercise directly lowers your blood pressure. Exercise lowers your blood pressure indirectly also through other mechanisms, like it reduces your body weight, and sustainability in weight loss is important. So if you are very obese, then exercising is very difficult. Okay, but once you lose weight, exercise becomes easier, and the more you exercise, the more you lose weight, the more it becomes easier and sustainable. So no matter how hard it seems initially, thankfully I see a very healthy population here, not a lot of people with obesity or weight issues. But if you start exercising and lose a little bit weight, every next step becomes easier than the previous step. So exercising makes weight loss sustainable. If you only do diet, the dieting is as hard as it will ever be. Dieting does not improve dieting. Exercise keeps on improving exercise. So exercise regimen adds sustainability to your weight loss program, because with exercise every next step becomes easier. Okay. Of course, it has to be paired with a balanced diet. If you are only exercising, not drinking a lot of water, then you will have fluid and electrolyte deficiency. And diet and exercise, they act synergistically. So what should you hope for? You should hope for plenty of fluids, fresh fruits, vegetables, low sodium, high. So this is the diet plan, which is called dietary approaches to stop hypertension, DASH diet. This is an one diet fits all. Like every person should be following this diet plan, and this is more about what and how much you should eat, rather than like dietitians give you a chart that make one chapati this time that. So you should understand what you should eat rather than when to eat. So eat a lot of fruits, lot of vegetables, whole grains. Limit food high in salt, sugar and saturated fat. So what has a lot of salt? Processed food, chips, kurkure, namkeen, ye sab. But apart from that, almost all processed food have high salt, because salt is a very good preservative. It's not a chemical, but so you pick a processed food, it will have high salt content. So all processed, packaged, preserved food would have high salt content. And of course, kurkure, namkeen, to okay. High refined sugars. So chocolate in itself is not bad. Chocolate is actually healthy. There are a lot of flavonoids and which help with oxidative stress. So chocolate is not bad, chocolate is healthy, but the lot of added sugar in the chocolate is bad. Okay, but considering all the sweets, chocolate is one of the healthiest, I would say. Apart from that, जो Indian जितनी भी confectionaries है ना, dairy based बर्फी, लड्डू, गुलाब जामुन, all high on sugars, no low benefit. So apart from chocolate, most of the desserts are not good for you. Especially the sweeter the taste, the bad they are. If you are into volume eating of sweets, like you eat a lot of sweets, replacing them with artificial sweeteners are no good either, because we as of yet do not have a perfectly safe artificial sweetener, है ना. आप कोई भी नाम ले लो, aspartame और ये वो, everybody has their own disadvantages, and the natural sweeteners like stevia, they don't really taste that good. Like if you are eating for a taste, then why eat stevia? I can't comprehend why people like it. Okay, but some people do, so that is like okay, okay. Then comes the saturated fat, that is also bad. So how do you know which one is saturated fat? A simple test. If it becomes solid in winters, it has saturated fat. So anything जो कि फ्रिज में जम जाती है, that is bad, है ना. मक्खन, बटर, घी, कोई भी आपने गोश्त बनाया और फ्रिज में रखा और जम गया, तो इसका मतलब it has saturated fat. Ballpark, you can say any red meat, mutton, beef has saturated fat. Okay. Fish and chicken has minimal saturated fat. Okay. So fish has lot of good stuff. So opposite to saturated fat is polyunsaturated fat. So PUFA content is good for you. Okay. Omega-3 fatty acids, they are good. Monounsaturated fatty acids are also good. So many people are very fond of asking the question, कौन सा तेल खाना है? Doesn't matter much. There is no evidence to say that olive oil is better than mustard oil. Mediterranean diet is better, but we don't know which component of Mediterranean diet derives the benefit. So Mediterranean diet is a diet plan which people follow. You can say Italy is one of the typical. They have red wine, which I think most of us don't or can't consume. Then they have lot of raw olive oil, and they have lot of raw stuff, salads, cut salads, then olive oil dressing. So Indian food is not Mediterranean food. अगर आपने सब्जी olive oil में बना ली आलू की, तो that's not really Mediterranean diet. So we don't know which oil is best, but polyunsaturated fatty acids should be highest, saturated fatty acids should be lowest. Apart from that, there is one criminal fatty acid which is called trans fatty acid. That is absolutely the risk would be 2-3% with saturated fatty acid, it would be 25% with trans fatty acid. So it's a mandatory requirement by law even in India that all packaged foods should have trans fatty acid content mentioned. What is the typical trans fatty acid product? Anybody? Which? No. Which fortunately is now declining. Even the advertisement I don't see so often. Dalda. Hydrogenated fatty acid. So any oil you hydrogenate, then you make it into trans fatty acid. Why people used to do it? Because it improves the shelf life. If you keep an oil in a storage container, it will become rancid. It will degenerate, it will start smelling. After few years, the mustard oil will become very bad, or any oil. So to improve the shelf life so that the oil doesn't get spoiled, it used to be hydrogenated and was converted into dalda. So hydrogenated vegetable oil are the worst. Fortunately, we don't use much anymore. People have caught on to it, and the companies have also started less एडवर्टाइजिंग, है ना. पहले तो डालडा का ऐड, हम लोग जब बचपन में थे तो डालडा का बहुत ऐड आता था, अब उतना नहीं आता है. ठीक है, दैट इज़ अ वेरी गुड थिंग. सो डालडा शुड नॉट बी ब्रॉट इन एनी ऑफ द होम्स बिकॉज ऑफ इट्स हेल्थ हैजार्ड्स. बट what are the other sources of trans fatty acids which unfortunately are still very common? So trans fatty acid generation happens when you heat an oil, cool it, heat it again, cool it again, heat it again. So the number of times the oil is heated and cooled, it generates a tiny trace of trans fatty acid. In normal home cooking it does not matter. You should not be scared कि भैया तेल को गर्म नहीं करना, trans fatty acid हो जाएगा. In a single or couple of cycles of heating and reheating does not matter. But आपका जो कॉर्नर हलवाई वाला है, जिसकी कढ़ाई में तेल जाता है फिर वो निकलता नहीं है, यू डोंट नो हाउ मेनी टाइम्स इट इज़ हीटेड, रीहीटेड, हीटेड, रीहीटेड. सो गली के कॉर्नर की शॉप का समोसा इज़ डेंजरस. अनफॉर्चुनेटली दे डोंट हैव रेगुलेटरी अथॉरिटी ऑल्सो. कोई जाके उनकी कढ़ाई का उसको टेस्ट नहीं कर रहा है. हाउएवर देयर हैव बीन स्टडीज इन इंडिया which have shown that reheated oil has significant trans fatty acid generation. It's not as high as say dalda. It would not matter that much अगर आपने 4 महीने में एक समोसा खा लिया. But if you are in habit of eating a samosa as a snack daily from your local halwai shop, then it's a problem, because reheated oil is still very common in India, and it is one of the sources of unrecognized risk that you take and you don't even know. Okay, oil in itself is not that big a problem. If you are taking oils which have monounsaturated fatty acid, fish oils are in fact maybe somewhat healthier. Okay, but the type of oil is important. Saturated fatty acid content should be less. And of course, if you are eating parathas every day with oil dripping, then that's a problem, because oil are the most energy dense source. Like if you drink 1 chammach of oil, you eat a lot of calories. So oil contain more calories than sugar. So amount of oil would lead to your more calorie consumption, but it does not lead to a spike in sugar. If you measure your blood pressure, and oily food actually delays the digestion. So the spike in blood sugar happens less with oily food. But oil increase your calorie intake. That is why too much of oil is not good. Saturated fats, if you take, then you directly worsen your health, increase your cholesterol levels, and it is bad. So it's your plate should look like this. Okay. Lot of this. If it is bread, it is whole wheat bread. Although इसमें दिख नहीं रहा है, it is brown bread, not white bread. Refined carbohydrate should not be there. Okay. Fresh fruits, vegetables, cheese is also good. Okay. This minimum. Okay. Red meat nahi, chicken you can have. Okay. Egg you can take 1 egg a day is okay. If you are eating lots of eggs, then it is better not to consume yolks a lot, because egg yolk has a lot of cholesterol. Okay. High risk patients. What are high risk patients? People who have had actually suffered a stroke or an MI. Should they also exercise? Yes, they should. Although it should be supervised. It has been shown that cardiac rehabilitation, we have a special term of exercise in, like है ना, आजकल ज़माना ये है, अगर आपने किसी को fancy term दे दिया तो वो it is more widely accepted. So if you say just exercise, patient would all know, we will do your cardiac rehabilitation. So it seems more impactful that, so what is that? It is just exercise after you have had a cardiac event. So cardiac rehabilitation, it has shown to improve outcomes, and it should be done. Unfortunately, because of lot of logistical reasons, we are not able to do it. If I say after heart attack you go and exercise and the person actually does it and he falls, so monitored exercise. But today we are living in an era in which monitoring is very much possible. Just buy a smartphone, buy a smartwatch, which already most people have. If not watch, smartphone to everybody has. So you can count your steps. With a watch you can monitor your heart rate. You do exercise and then you reflect back on the trend. What was your peak exercise heart rate? As I discussed earlier, it should not go too high, it should not be too low. So if you have hypertension, you should exercise even if you have an event. Even if you don't have hypertension, you should still exercise, because exercise is helpful for all individuals. Like healthy lifestyle mein, there are two components, diet as well as exercise, and reducing stress. So not two, there are a lot of other components. So what are the long term benefits? Immediately your goal is, okay, reduce blood pressure. I am done with it. My blood pressure is now okay. I should stop exercising. No. So exercise is a lifelong objective. So it reduces, I have only mentioned heart and stroke because that's most relevant to me, but it has lot of other health benefits. It reduces the risk of diabetes, obesity related dyspnea, heart failure. Okay. It also enhances mental well-being, which is an important aspect which a lot of people ignore. It improves your endorphin levels. It releases dopamine. So people who are used to the adrenaline kick and the surge of endorphins when they exercise, when their gym is closed, they will feel saddened. So it's a very important stress mitigator, and it improves and enhances your mental well-being. If you are too stressed, you eat an ice cream, you will feel better, but that has no health benefits long term. If you are stressed out, go for a walk. That will help your stress, that will improve your mental well-being, and it will have added benefit. And it has been unquestionably shown to increase your lifespan as well as quality of life. Unfortunately, everybody ages. It's a fact of life. With aging comes deterioration in your structural skeletal framework. Your joint starts to ache. Your muscles, they lose their strength. Getting up, going to the bathroom becomes difficult. All that can be delayed with exercising. So it not just prolongs life, it improves your quality of life. Quality of life is a very important measure. So, but there are a lot of barriers. As I said at the beginning, everybody at one time or the other, it takes a decision. But unfortunately, for some reason or others, they can't follow through. So what are the key barriers? So one thing is lack of time. A lot of people say, I don't have time. So simple. Whenever you have short breaks, take a sprint. If you are going from one building to other, don't walk slowly, walk at a fast pace. Okay. The faster you walk, the better it would be. Don't think too much what other people will think. Abhi to pagal hai yaar, din bhar daudta rehta hai na? Get over it, and everybody would get over it. Okay. So there is no time to exercise. You can exercise any time you want and it will give you benefits. It's not like कि early morning walk is the best and जब आप शाम में walk करोगे तो वो best नहीं है. Only consideration is if you try to exercise on a full stomach, that may not be the best time. So immediately after eating, ideally you should not eat that much that you need to walk around to settle your stomach. खाना खाने के बाद जो चलते हैं वो पेट में चीज़ें एडजस्ट करने के लिए. आपको इतना खाना ही नहीं चाहिए कि आपको चलने की ज़रूरत लगे. खाना खाने के बाद everybody must have observed you cannot really run because a lot of blood goes into the stomach to help with the digestion process. इसीलिए it is recommended that you should rest after eating. है ना? Calula is important and a scientific concept that after eating you should rest for 15-20 minutes. So on a full stomach you should not exercise, but a cup of tea, a couple of biscuits, it's not really that much of a food. So you had a cup of tea, that is not an excuse not to exercise. Okay, you just should not be full stomach. Okay, especially for people who already have cardiovascular disease. So if you are having angina, if you are full stomach and you want to try to exercise, your chest pain would worsen. So that is the only precaution. Then fatigue is one of the other barriers that for my patients it is quite often very common that they had an event, they never exercised in their life. Now they had an event, now I tell them to exercise. Now they come, Doctor Sahab, to ho nahi sakta, I cannot walk to the bathroom. So in that situation, no exercise is very little exercise. If you get up from your chair and go to the bathroom, that is also your exercise. Do it 30 times a day. Not pee, but do it. So just walking around, say like this is exercise. है ना? It's not difficult to do. Anybody who can do this can do this. है ना? So 1 month of doing this, then you can walk the room, and then you can go out and walk the mohalla, and then you can increase your pace. So you start really slow. If you cannot, people who cannot get from bed, like lot of people have excuse that I have hip pain, I have knee pain. So do this. This is also exercise. Okay. So any part of body that you can move, move it. Do it repeatedly, and over time your exercise capacity would improve, your level of fatigue would improve, and you will, how much level of exercise you may be able to achieve, that varies. I'm not saying that you start doing this and then you will be a marathon runner, but it would be better than yesterday, and it will keep on getting better and better and better. Then another very common issue in India especially, where there is negative degrees and then there is 50 degrees, is weather. So develop some indoor activity. है ना? Some equipment helps. है ना? Treadmill, exercise, bicycle, but with equipment you should always be careful not to hurt yourself. So get familiar with the equipment, practice with very low workloads initially. When you are very used to it, then do it. So amongst equipments, treadmill, cross trainer, I'm sure you must have all heard, but there are a lot of other things also, like resistance band, so elastic bands which you can stretch. You can stretch in your hands, you can put them in your feet and then stretch them. So depending on which body you apply to, you can do resistance training of any body part. So not just aerobic activity, resistance training can also be done with very simple and cheap equipment. You don't have to have weights and all. Weights also have a problem that people with less dexterity, especially elderly people, if they are lifting weights and it slips, it falls, the chances of injury is much more. So with lighter workloads, with resistance band, and they also come with varying degree of stiffness. So there can be bands which are very light, very loose. So some equipment and doing activities at home would give you more flexibility to do it whenever you want. Also, there are other strategies to improve compliance. Find an accountability partner. Yet that can be your life partner as well. And you poke her, she pokes you. That aaj ki nahi hui exercise. Lao, give me your watch. Let me check how many steps you have had today. So an accountability partner helps. You can have an app for motivation. So there is a plethora of apps which now can help you count your calories. They can count your steps. They can make you formulate your diet plan. Set goals also. That I have to walk 2000 steps. If I was walking only 500, then you set your goals. Don't set your goals which are unachievable. Like you are only walking 2000 steps and you have set a goal of 20,000, which you can never achieve immediately, then you will not have progress. You will be walking 3000 steps every day for the next year because you never meant to achieve that goal. So set a small goal and revise them. Track your progress and then revise them. So you can have different levels of activity. So for a beginner who is not exercising, you can just start with light workloads like walking, some passive stretching, improve your muscle flexibility. For intermediate step people, they can add some resistance training, some weights, some resistance band, some cycling, and then you can incorporate higher intensity interval training, endurance training once you are more advanced. So every person would have different exercises that would suit their needs best. So there is no one exercise that is best for everybody. And with progressive workouts, you have to adjust and you have to adapt your regimen. The same exercise regimen that was best for you 10 years ago would not be best for you today, and you should consult your doctors or physician or trainer likewise. So this is one sort of exercise plan. The key thing is that exercise can also be boring, like really boring. So you want to exercise for 30 minutes, if you see the time, you would feel that I have exercised enough. You will, तो सिर्फ 10 ही मिनट हुए हैं. So it is important for you to have some, like some people listen to music or mix. You do something someday, something other, so it doesn't get boring and you don't quit. So it's not a recommended pattern. Nobody has to follow like this every day and this is the best way. I'm just showing that you can have variability. One day you are walking, one day you are cycling, the other day you are doing deep breathing yoga and then resistance training, because every type of exercise gives you some benefit and the other type of exercise would give you some other benefit. So if you are doing only one exercise every day, then you are missing out on some benefits. So if you are mixing different kinds of exercises, then you are getting more benefit for your time spent. Of course, there is no reason for everybody to swim if they can't swim. Okay, so you have to find what suits you best. And as I mentioned, we are living in an era where technology is very, very easily accessible and it helps us a lot. And there is a lot of evidence, lot of studies. So high intensity interval training is your goal. You want to get there because that is the best form of exercise. You run, you rest, you run and you rest, in nutshell. Okay, so high intensity workouts followed by low intensity workouts or rest, they are the most effective way to lower your blood pressure than a simple moderate sustained exercise. Okay, resistance training added to aerobic activity helps more, and even short burst of exercise, they help. So it's not like if you exercise only 15 minutes, there is no benefit. Even if you exercise 5 minutes, there is benefit. If you exercise 15, the benefit is more. If you exercise for 50 minutes per day, even more. Okay. So how to prevent hypertension? Up till we were talking about if there is hypertension, you should exercise. But even if you don't have hypertension, you should still exercise. You should start exercising early in your life so that you don't develop hypertension. Okay. Make physical activity a daily habit. Like I said, going to the corner store, grocery, walk, run, don't use vehicle. Lot of now watches have inactivity alarms. If you can program that if I am sitting still for 30 minutes, it will buzz you. So avoid prolonged sitting. Unfortunately, screen time is one of the, like myself is guilty somewhat, that you switch a screen and you are sitting, like hours pass by and you are not doing anything. So even if you are intermittently getting up from your chair, walking around in the hall and then coming back, so pause your stuff, take a break, walk or run or jog and then come back. Okay. Then there are certain myths that some people feel that strength training, it increases the blood pressure and aerobic activity would lower the blood pressure. That is not true. Resistance training would also help with lowering of blood pressure, not just aerobic activity. Flexibility and strength, they both matter. It's not just the aerobic cardio workout that works well. Why they are the most famous? Because they are the easiest to do. Anybody can start walking. That is why cardio workout is most famous, most prevalent, because they are the easiest. The chances that you will injure yourself are the lowest. So for a beginner, a cardio workout is good and effective. But if you want to have the most from the time spent in exercise, you should add some resistance training as well. So just to end the long and I hope not so boring session, stay consistent with your exercise. That is key. It does not matter you did a very quality workout for 3 months. 6 months down the line, the benefit would be lost. Combined movement or exercise with good diet. You are eating a lot of carbs, lot of sweets, it would counterproductive. Okay, monitor your progress and adjust as needed. The same exercise which was helping you 10 years ago may not help you as much now. So any questions? I hope there are some. No, good audience. Chalo, anyways, thanks for patient listening.
Thank you very much, sir, for giving us your precious time and enlightening us very important information regarding heart and how heart is working and how the exercise is benefit for the heart and other exercise. And sir nicely explained how to manage the exercise and how to calculate the intensity and how to relate with the exercise with your activity and for your heart. For example, which type of exercise is benefit for your hypertension and which type of exercise is for diastolic blood pressure. And sir also explained the different type of diets and exercise for the rehabilitation purpose, cardiac rehabilitations. I'm also say you, please don't hurt your heart by your sedentary lifestyle and bad eating habits. Do exercise and take good diet to make heart healthy. कहते हैं कि हार्ट धड़कता हुआ दिल नहीं होता, बड़ी एक्सरसाइज करनी पड़ती है दिल को दिल बनाने में. Thank you very much once again.